when your body is screaming for help without you noticing. There is something happening right now inside your body that you are probably not seeing. It is not a sharp pain. It is not a symptom that sends you rushing to the emergency room. It is something far more silent, far more treacherous, and for that very reason, far more dangerous. We are talking about a deficiency that affects more than 2 billion people worldwide, according to the World Health Organization, making it the most common nutritional deficiency on the planet. And the vast majority of people do not even know they have it. Iron is a mineral essential to human life. Without it, your blood loses its ability to transport oxygen, your brain begins to fail, your immune system weakens, and your organs start working at their limit. And the most frightening part is that many of the signs of this deficiency are so common, so ordinary, that people simply ignore them for years. The deficiency that hides in plain sight. Today, you are going to learn how to read what your own body is trying to tell you. Because those signs are there, visible, waiting to be recognized. Some of them you can check right now, without any equipment, simply standing in front of a mirror. And recognizing them in time can literally save your life. But there is a fact about iron that most people have never heard, and it completely changes the way you will look at everything that follows. What iron does inside you that no other mineral does. The best known function of iron is its role in hemoglobin, the protein inside red blood cells responsible for transporting oxygen from the lungs to every cell in the body. What few people know is that iron sits literally at the center of this protein, acting as the binding site where oxygen attaches to be carried. When your iron levels are low, red blood cells become smaller, paler, and incapable of fulfilling their function, and every organ in your body begins operating in scarcity mode. But oxygen transport is just the beginning. Iron is also essential for the functioning of the immune system, for the synthesis of neurotransmitters such as dopamine and serotonin, and even for the process of cell division. Almost nothing in your body works well without sufficient iron, and when it is lacking, the signs appear in the most unexpected places, many of them visible to the naked eye. Why doctors use iron as a starting point? This is exactly why doctors use iron deficiency as a starting point for far more serious investigations. Discovering that a person has low iron can be the first step toward finding something they never would have suspected existed inside them. The consequences of ignoring the signal can be far greater than simply feeling tired. And the first visible sign we are going to explore can be checked right now, without any equipment. The color that vanishes. The sign that is on your face right now. The most classic first sign of iron deficiency is paleness, but we are not talking about having slightly fair skin. We are talking about a paleness detectable in specific places, regardless of your skin tone. Gently pull down the lower eyelid of one of your eyes. The inner surface that appears, called the conjunctiva, should have a vivid red or pink color. If that area is pale, almost white, this may be a sign of anemia. This test works for anyone, making it one of the most universally applicable in clinical medicine. Another revealing area is the creases of the palm. When you open your hand and stretch your fingers, the lines of the palm normally appear darker than the surrounding skin. If they are hard to see, almost the same color as the palm itself, this may indicate low hemoglobin. It is worth noting that in people with darker skin, this sign may not be conclusive and should be considered alongside other signs. What paleness reveals beyond appearance. These signs are clues, not diagnoses. This content is informational in nature and does not replace the evaluation of a qualified physician. If you suspect any deficiency, seek a healthcare professional for proper investigation. Paleness alone can have many origins, but when it appears together with other signs from the body, the picture begins to take on a much more specific meaning. And the next sign is probably the most overlooked of all, because it seems to have 1,000 other explanations. The exhaustion you normalize without knowing why. The second sign is disproportionate exhaustion. You wake up tired. You climb a flight of stairs and feel your heart race. You carry the groceries and run out of breath. You probably blame it on stress or poor sleep. But it may also be iron deficiency. When the body does not have enough hemoglobin to carry oxygen, every everyday activity demands a disproportionate effort from the muscles and the heart. The heart, sensing that the blood is not delivering enough oxygen, tries to compensate by pumping faster. This is why people with iron deficiency anemia frequently report palpitations, the sensation that the heart is beating too hard or too fast, even at rest. This compensatory mechanism works for a while, but progressively overloads the heart. when tiredness does not pass, even with rest. The fatigue of iron deficiency has a particular quality. It is not the normal tiredness at the end of the day. It is an exhaustion that does not go away with rest, present the moment you wake up, one that makes even the effort of following a conversation feel difficult. Memory becomes foggy, productivity drops, and there is a constant sensation of functioning at half capacity. Many people live in this state for years without ever connecting it to iron, simply because it is easier to blame stress. If you recognized yourself in this, the next sign can be checked right now by looking at your own hands. The nails that change shape, the test you can do at home. The third sign is in your nails. Look at them from the side. Under normal conditions, they have a slightly convex curve, like a gentle dome. In people with severe iron deficiency, the nails can become flat and, over time, concave, taking on the shape of the inside of a spoon. This phenomenon is called koilonychia, and when it appears alongside other symptoms, it serves as a reliable marker of iron deficiency anemia. There is a simple home test. Place a drop of water in the center of your nail. On a healthy nail, the water slides immediately to the sides because of the natural curvature. But if it stays in the center, trapped in a small depression, this may indicate koilonychia. There are documented reports of young patients whose only visible sign was exactly this change, which led doctors to investigate and confirm severe anemia. What your nails say about your blood. Nails reflect the internal state of the body in a way that frequently surprises even doctors themselves. They are made of cells that depend on iron to develop properly, and any failure in this process leaves a visible mark. Paying regular attention to them can be a simple habit that makes an enormous difference. And the next sign is even more unusual because it involves a craving that seems absurd but has a completely real physiological explanation. Eating ice, dirt, and things that are not food. The mystery of pica. The fourth sign is one of the most unusual. Pica, the intense and compulsive desire to consume substances that are not food. The most common form associated with iron deficiency is pagophagia, the irresistible urge to chew ice. If you know someone who constantly refills their glass just to chew the ice, this may be a clear sign that their iron levels are low. For doctors, this behavior is one of the first clues that leads to an investigation of iron. But pica goes beyond ice. People with severe deficiency have reported uncontrollable cravings for raw cornstarch, chalk, clay, and even rocks. In documentary programs about extreme eating behaviors, cases have been followed of people consuming more than 900 grams of cornstarch per day, or even fragments of rock on a regular basis. The most widely accepted explanation is that the body develops these cravings as a confused attempt to find missing minerals, even though the desired substances do not actually contain them. When the body asks for what it cannot name, it is like an internal alarm going off but pointing in the wrong direction. The body knows something is missing, but cannot translate that need precisely. This phenomenon appears more frequently than one might imagine, and many people never connect these behaviors to a treatable nutritional deficiency. If you have or have had unusual cravings, especially for ice, it is worth talking to your doctor. The next sign can be spotted simply by opening your mouth in front of a mirror, and very few people know it exists. The tongue that goes smooth. What it reveals about your iron. The fifth sign is in your own mouth. Open it and observe your tongue. Under normal conditions, it has an irregular surface covered with small protrusions called papillae, responsible for texture and the taste of food. When iron is low, these papillae gradually disappear, leaving the tongue with a smooth, almost polished appearance. This condition is called atrophic glossitis. It is not just an aesthetic matter. The papillae are made of cells that need to renew themselves constantly, since the tongue is in continuous use. Without iron, this regeneration is compromised, and the papillae slowly vanish. Patients typically report a burning sensation in the tongue and notice that food loses its flavor or tastes different than normal, directly interfering with quality of life. Why the tongue is the body's first mirror. The tongue is one of the parts of the body that most rapidly reflects nutritional deficiencies, precisely because it depends on fast-renewing cells. Small changes in its appearance can signal internal imbalances long before other tests detect them. It is worth making a habit of observing it closely from time to time. And speaking of signs that reveal something internal, the next one is one of the most curious on the list, and involves something you probably eat frequently. The beet that can reveal a secret about your blood. The sixth sign is indirect but fascinating. Bituria, the reddish coloring of urine after eating beets. Did you know that this phenomenon can serve as a rudimentary clue about your iron levels? Beets contain a pigment called betanin, responsible for their intense color. When consumed, part of this betanin is absorbed and, if not broken down by the body, is eliminated in the urine, turning it pink or red. This phenomenon is called beaturia. What makes this relevant is that beaturia occurs in only about 10% of healthy people, but in approximately 80% of people with iron deficiency. This happens because iron participates in the breakdown of betanin. Without enough iron, the pigment passes through the body nearly intact. It is not a diagnostic test, but it is an interesting observation that illustrates how iron is involved in processes far beyond what most people imagine. What the color of your urine can indicate. That said, any reddish urine that cannot be clearly attributed to beet consumption should be investigated by a doctor immediately, as it may indicate far more serious conditions. The color of urine is a simple and accessible window into internal health, and it deserves attention. And there is another sign that appears in an even more unexpected place on the body, something that many people treat with cream without ever investigating the true cause. The cracks at the corners of your mouth that never fully heal. The seventh sign is those painful sores that appear at the corners of the mouth, burn, and seem to never want to heal. They have a name, angular cheilitis. It can have various causes, but iron deficiency is one that frequently goes undiagnosed. Corner of the mouth is a complex region where the moist interior of the oral cavity meets the dry skin of the face. This area needs to be thin, elastic, and resilient at the same time, withstanding hundreds of movements every day. To remain that way, it depends on constant cell regeneration. Without iron, the tissue loses this capacity. It cracks with normal movements, creating an entry point for fungi and bacteria, resulting in inflammation that cannot heal. It is a self-reinforcing cycle as long as the cause goes untreated. When treating the symptom does not solve the problem, many people use only topical creams for months without ever investigating whether there is an internal origin. The relief is temporary because the cause remains untouched. If you have this problem on a recurring basis, including a check of your iron levels at your next appointment may be the step that finally resolves it for good. The next sign involves your defense system, and the mechanism behind it completely changes the way you think about recurring infections. The immune system, fighting without ammunition. The eighth sign is increased vulnerability to infections. Iron is also ammunition for the immune system. Defense cells depend on it to produce compounds that function as biological weapons to destroy fungi, bacteria, and other invaders. Without enough iron, these weapons are weakened, and the body becomes far more vulnerable to infections. A visible example of this is ringworm, a fungal infection caused by organisms called dermatophytes, which penetrate the skin through small fissures and spread, forming that characteristic reddish ring. Although it can affect anyone, ringworm is more common in individuals with iron deficiency because the immune system simply does not have the resources to contain it efficiently. The same organisms cause athlete's foot and other recurring superficial infections. Frequent infections may have a cause you did not expect. And it is not only fungal infections. Vulnerability to bacterial infections also increases, both in the skin and in the respiratory tract. People who fall ill with unusual frequency, or who take a very long time to recover, may be suffering from a deficiency that is silently weakening their shield. Without iron, the body cannot just produce energy or carry oxygen. It also cannot defend itself. And the next sign affects something even more intimate: the quality of your sleep. The restless legs that steal your rest. The ninth sign is restless leg syndrome. Imagine lying down ready to sleep and feeling an irresistible urge to move your legs. It is not pain or a cramp. It is an uncomfortable sensation that only eases with movement and returns as soon as you stop. This is restless leg syndrome, and its relationship with iron runs deeper than most people realize. The most surprising point is that iron deficiency can cause this problem even when blood tests show levels within the normal range. This happens because the brain manages iron differently from the rest of the body, and can suffer a shortage of this mineral even when serum values are technically acceptable. Studies indicate that up to 60% of people with restless leg syndrome improve with iron supplementation, even without confirmed anemia. But iron has to do with the quality of your sleep. If you suffer from this problem, and your ferritin is at the lower end of the normal range, it is well worth discussing this with your doctor. Sleeping poorly due to something treatable is a loss of quality of life that does not need to persist. Sleep is the time when the body repairs itself, and anything that compromises it affects the entire day. And speaking of something that profoundly impacts quality of life, the next effect of low iron goes beyond the physical body. when iron deficiency affects how you feel on the inside. The 10th sign is mood disturbance. Iron is essential for the production of dopamine and serotonin, two fundamental neurotransmitters for regulating mood, motivation, and pleasure. When iron is lacking, the brain does not have the ingredients needed to produce these compounds in sufficient quantities. This means that iron deficiency can manifest as depression, irritability, difficulty concentrating, and lack of motivation. Because these symptoms have countless possible causes, the connection to iron is rarely investigated. Patients are treated with antidepressants without ever having a simple ferritin test done. Doctors who approach mental health comprehensively include iron deficiency among the hypotheses to rule out, especially in women of childbearing age, pregnant women, and people with restrictive diets. The ingredient your brain needs to function well. Iron is not merely a component of blood. It is an essential ingredient for your brain to function well and for you to feel like yourself. Ignoring iron levels when investigating mood disturbances can mean years of misguided treatment. And the next effect goes even further, reaching a risk that almost no one would associate with this mineral. The extreme risk that few associate with iron deficiency. The 11th sign is also the most serious. In severe and prolonged cases, iron deficiency can increase the risk of stroke. The mechanism is as follows. In response to anemia, the body increases platelet production as a compensatory strategy. But when platelets reach excessively high numbers, a condition called thrombocytosis, the blood becomes prone to forming clots in the wrong places, including the arteries that supply the brain. A case series published in a major neurology journal documented exactly this. Young women with no traditional risk factors for stroke who suffered strokes. The investigation revealed that the only common denominator was severe iron deficiency combined with elevated platelet counts. Rare cases, but documented and concerning. When what seems simple hides a greater threat. This is one of the most compelling arguments for not ignoring the signs of low iron. What begins as paleness and fatigue can, in extreme situations, become a real threat to life. Iron deficiency is not just an energy problem. It is a condition with ramifications that reach virtually every system in the body. Before discussing diagnosis, there are 3 smaller signs that complete the picture and that you need to know. The subtle signs that complete the picture. 3 lesser-known signs round out the list. The 12th is chronic itching with no apparent cause. Low iron can alter the nervous sensitivity of the skin and cause dryness, generating a persistent itching sensation even without any visible lesion or identifiable allergy. It is an underestimated symptom that can last for months without anyone investigating its origin. The 13th is hair loss. Hair follicles are among the fastest dividing cells in the body and depend on iron to remain in the active growth phase. When iron drops, follicles enter a resting phase prematurely, resulting in diffuse and gradual hair loss that is rarely associated with iron deficiency. Dark circles, itching, and hair. What your body is trying to show you. The 14th sign is dark circles under the eyes. The skin beneath the eyes is extremely thin, and when hemoglobin is low, the veins just below the surface become more visible, creating that characteristic purplish tone. Many people treat dark circles with cosmetics without ever investigating whether there is a correctable internal origin. Added to all the other signs we have discussed, these 3 complete a clinical picture that clearly points to iron deficiency. And now, we arrive at the most important step in this entire conversation. Diagnosis. How to diagnose, the test everyone should know about. The most important test for investigating iron deficiency is the ferritin assay, the protein that stores iron in the body. Ferritin drops before other markers change, allowing the deficiency to be detected at early stages, before full anemia has set in. A low ferritin level is a very reliable sign that iron reserves are being depleted. But there is a complication. Ferritin also rises in situations of inflammation, infection, or cancer. This means that a normal or high value does not completely rule out deficiency, especially in people with inflammatory conditions. For this reason, doctors frequently order a complete iron panel, including serum iron, total iron binding capacity, and transferrin saturation, providing a far more precise picture of this mineral's metabolism. Why diagnosis is only the beginning. Upon receiving the diagnosis, the most important question is not just how to treat it, but why it happened. The cause of iron deficiency matters as much as the deficiency itself, because it can point to something far more serious hidden behind the symptoms. The answer may reveal something that goes well beyond a simple nutritional deficiency, as you are about to discover. Why your iron is low. The investigation that can change everything. There are 3 major causes of iron deficiency. The first is increased demand, as in pregnancy, when the body needs iron not only for the mother, but also for the development of the baby. The second is reduced intake or absorption. Animal-based iron is absorbed 2 to 3 times more efficiently than plant-based iron, found in lentils, tofu, and spinach. Furthermore, many vegetables rich in iron contain phytates, compounds that actively block the absorption of the mineral. Conditions such as celiac disease, Crohn's disease, and gastric bypass surgery also compromise absorption even with an adequate diet. The third cause is the most concerning: blood loss. When the bleeding is visible, as with heavy menstruation, the cause is obvious. But when it is internal and silent, the situation is far more serious. Colon cancer, for example, frequently bleeds so discreetly that the blood is not visible in the stool, and this slow bleeding gradually depletes iron reserves over months. In many cases, anemia is the only early sign of the tumor, the invisible bleeding that may be happening right now. This is why doctors who identify unexplained iron deficiency in adults, especially those over 40, frequently order a colonoscopy. This investigation has already led to the early detection of tumors that, without the clue of anemia, could have grown silently for much longer. The signs you see in your body are not merely inconveniences. They are messages that can save lives. And now that you know this, the next step is to find out what to do with that information. What to do now? Treat, absorb, and act. When iron deficiency is confirmed, the most common treatment is oral supplementation with iron salts. In more severe cases, or with compromised absorption, iron is administered intravenously, ensuring complete absorption and faster results. But just as important as taking the supplement is making sure it is absorbed efficiently by the body. Vitamin C is iron's greatest ally. Consuming orange, tomato, bell pepper, or guava alongside iron-rich foods, or alongside the supplement, can significantly increase the absorption rate. On the other hand, the calcium in dairy products competes with iron for the same intestinal absorption pathway, and tea and coffee contain tannins that block the mineral. Both should be consumed at separate times from supplementation. The allies and the enemies of iron on your plate. A practical tip that few people know: cooking with cast iron pans can help increase the iron content of food, especially in acidic preparations such as tomato sauces. It does not replace treatment, but it is an accessible complement in everyday life. If you recognize yourself in any of the signs discussed in this content, do not wait for the fatigue to become debilitating before taking action. Do not wait for anemia to be fully established. Schedule an appointment, ask for a complete iron panel, and ask the most important question: why? The human body is extraordinarily intelligent. It sends signals before it breaks down. Your task is to learn to listen to them, and the answer to that question may change your future in ways you cannot yet imagine.